If you were told you have small lymphocytic lymphoma, SLL, and then you saw the words CLL, it can feel like your brain short circuits because you're like, wait, do I have lymphoma or leukemia or both? And why does it sound like two different cancers? Today I'm going to explain SLL in plain language, what it is, what symptoms people commonly notice, how it's treated, and why you'll often hear CLL mentioned right alongside it. And most importantly, we're going to take the panic out of the words. One more quick thing. SLL is not small cell lymphoma. People confuse those terms online, you're down the wrong rabbit hole. Small cell usually refers to small cell lung cancer, which is a completely different disease category. SLL is a type of non-Hodgkin's lymphoma in the same family as CLL. Hi, I'm Joe. I share cancer education and support in a way that's human, calm, and understandable because fear grows in confusion and clarity really does help. And just to be transparent, I don't have SLL. I have a different lymphoma diagnosis. But I'm making this video because SLL creates a lot of confusion. And if you're newly diagnosed or caring for someone who is, you deserve answers that don't feel like a medical textbook. Here's what we're going to cover: what SLL actually is, why people keep saying CLL, SLL, common symptoms, and why some people have none at first, how doctors decide when to treat, the treatment options you're most likely to hear about today, and what questions to ask at your next appointment. Quick note: if nutrition during treatment is part of your journey, I have a free download called Gentle Nutrition for Chemo Days. The link is below. It's there for the rough days. What is SLL? Small lymphocytic lymphoma, SLL, is typically a slow-growing, indolent type of B-cell lymphoma. Here's the simplest way to picture it. Your body has white blood cells called lymphocytes that are supposed to help fight infection. In SLL, CLL, one group of these cells becomes abnormal and starts building up over time. And where those cells build up most heavily, that's what changes the name, the CLL connection. This is the big confusion. So let's talk about why you'll hear CLL mentioned. CLL and SLL are basically the same disease. The difference is mainly where the cancer cells are found in the body. If the abnormal cells are mostly in the blood and bone marrow, doctors often call it CLL. If they're mostly in the lymph nodes, doctors often call it SLL. So when you see CLL, SLL, that's not someone being vague. It's literally the common way this condition is discussed because they're managed very similarly. Translation: hearing CLL mentioned doesn't automatically mean that something got suddenly worse. It's often about labeling and location, symptoms, what people notice, and why it can be subtle. One reason SLL causes so much uncertainty is that some people feel totally fine at diagnosis, and others have symptoms that are easy to dismiss. Common symptoms can include swollen lymph nodes, often painless, neck, underarm, groin, fatigue that feels deeper than normal tired, night sweats, unexplained weight loss, feeling full quickly or discomfort from an enlarged spleen, frequent infections in some cases, depending on immune effects. And here's what I want to say gently, because this can be slow growing. People may spend a long time thinking maybe it's stress, maybe it's age, maybe it's hormones, maybe I'm just run down. If that's you, you're not imagining it. This is one of those diagnoses where symptoms can be real and still hard to pin down early. Wait, do I need treatment right now? This is one of the most important things to understand about SLL, CLL. Many people do not start treatment immediately. A very common approach is called active surveillance. You may hear watch and wait. And I know that phrase can sound terrifying, like they're doing nothing. But in this disease, careful monitoring has been shown to be a safe, standard approach for many patients, especially when symptoms are mild and blood counts are stable. So the question isn't always, do I have cancer? It's often, do I have cancer that needs treatment right now? How doctors decide when it's time to treat. Doctors usually look at things like, Is the disease causing significant symptoms that are worsening? Are lymph nodes or spleen enlarging quickly? Are blood counts dropping because the marrow is crowded out over time? Are infections becoming a major issue? Is the disease clearly progressing on scans and labs over time? This is why you hear about people talk about SLL, CLL as a long-term condition that's managed in phases, monitoring, then treatment, if and when indicated, and then follow-up. Treatment options you'll hear about today. Okay, treatment. Let's keep this simple. SLL treatment can include active surveillance, watchful waiting, targeted therapies, medicines designed to block specific survival pathways in the cancer cells, immunotherapy, often antibody-based treatments, chemotherapy in some situations, less central than it used to be for many patients depending on case, radiation in select situations, sometimes for a problem area, and in more advanced or specific scenarios, stem cell transplant, CAR T, and clinical trials. If you're hearing lots of medication names from your doctor, that's normal. The big picture is treatment has evolved a lot, and many people today have more options than they realize at diagnosis. A gentle reassurance. If your mind is spinning, I want to normalize that. This is one of those diagnoses where the vocabulary alone can make you feel panicked. But SLL, CLL is often approached as a manageable chronic condition for many people. And outcomes have improved with modern therapies. A rare but important word, Richter transformation. You might also hear something called Richter syndrome. This is when SLL, CLL transforms into a more aggressive lymphoma, often DLBCL. It's not the most common outcome, but it's something doctors are aware of and monitor for. I'm mentioning it only because people see the word online and panic. If your doctor brings it up, it's usually in the context of awareness and monitoring, not a prediction. What to ask your doctor? If you want a practical list to bring into your next appointment, here are strong questions. Am I being diagnosed as SLL, CLL, or CLL/SLL, and why? What tells you that I do or don't need treatment right now? What signs would mean it's time to start treatment? What are the most likely treatment options for my situation? Are there any specific tests, genetic or risk markers you use to guide therapy choices? Should I see a lymphoma specialist or get a second opinion? Sometimes that's very helpful for peace of mind. If this video is helping you feel clearer and less afraid, liking it really helps this channel reach other people who are searching in that same worried way. If you're sitting with this diagnosis right now, I want to say this gently. You're allowed to be scared, and you're also allowed to breathe. SLL is confusing because of the naming, the watch and wait approach, and the CLL connection. But confusion doesn't mean hopeless. Your questions are valid. Your fear makes sense, and you deserve clear information and real support. If you want more lymphoma education videos like this, symptoms, diagnosis steps, and treatment explanations, subscribe and join us here. And if you want something gentle and practical, I'll link my nutrition support freebie below and a couple other videos you can watch next. You don't have to do this alone. Thank you.